Okay, I can see there's still some people ticking in, but I think we're just getting started. There are some others who said they're very close to joining in. So I think bit by bit, I'm just gonna start up. So we're doing this webinar for Viva. Oh, there was a little bit of sound. Elizabeth, you got the microphones? Thank you. So we're doing this small online event for Viva in Denmark, and most of you might already know the organization, but it's an organization who worked in Central America for about 25 years, mostly focusing on children and youth. So Viva works as a network in both Nicaragua and Honduras, and today we're going to have with us some people who have worked in Nicaragua and Honduras for many years. And the topic today, we're going to talk a little bit about how has the COVID-19 affected families, affected children and youth. And I think I'm just going to present the people we got with us. And I don't know if somehow you can hear when I'm talking a little bit of wind, because here in Tegucigalpa, it's very windy this morning. You don't hear any wind? Okay, that's good. With us, we have first Hilary Gomez, and Hilary, many of us Danish in Central America have known Hilary for a long time. She's been in many of the youth programs that we've done. She recently graduated from university in international relations, and yeah, congratulations. And Hilary is gonna help us pull down the average age of the panel, and she's gonna talk a little bit about what has it meant for youth in her region, in Honduras, the lockdown, how has it affected children and youth in schools and universities, social life, etc. And then we got with us Joanne, who is joining us from the US, but she normally lives in Honduras and have done that for so many years. She's the co-founder of an organization called ASJ that some of you probably have heard of. That is the Honduran chapter of Transparency International, working with promoting justice, making Honduras a more just society. And she's got a good overview of the overall societal consequences of the COVID, and also what with her some stories she's going to tell us. And then we got Jaime joining in from Nicaragua, and Jaime has worked with Viva for many years. And we're also going to look a little bit about how the two societies have reacted a little bit different to the COVID, but basically also what has been the consequences for children and youth in Nicaragua. And he's also going to share a little bit with us some recent surveys he did looking into how the COVID has affected children and youth, teenagers from a psychological point of view. But I think we're going to start with Hilary. You can unmute your microphone, Hilary. Hilary, maybe you can start telling us a little bit about when the COVID-19 hit Honduras back in March. How did it affect you? What happened back in the 15th of March when the lockdown started?
Yes, thank you, Arne. Hi, everyone. Nice to meet you all. I'm saying hi from Honduras. Like Arne says, I'm from. No, he didn't say this. I'm from Honduras in a chapter of. It's a platform youth of Alliance for Peace and Justice, a program of where is Joanne, ASJ, and right now we are working with a lot of young people with programs of empowerment and some things of security and civil society, a lot of this. Now in Honduras, the situation about COVID-19, this is a situation very difficult for us. I know that in all the world it's a difficult situation, but in Honduras, we we have like we have a country that is in a high score of poverty, and now this pandemic came and we have another consequences like psychological economic situations, and also employment, and what else, the situation of school, and like academic things. We have the situation of like for example, the childrens that they get in school, and in this year, because of the pandemic in March, that we start like 15 16 March 16th, yes. And the situation is that in like almost in June, that some kids that they don't have like a computer or a cell phone or access to internet, they get a little bit difficult to learn or to continue to studying in a school. So so they get out from school. In the economic situation is that was difficult to find a job, and now it's more difficult to find any job. And some students that they work and they study, the situation is that they lost her jobs and now they can continue studying. they 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 are out now because in the system of education. What else can I say?
How did Hillary? How did it? Maybe for because I know that many in Europe they know how lockdown what happens during lockdown in Europe, but how did lockdown happen in Honduras? What how did it affect you? Could you go out and like you wanted, or what was the
And
consequences?
no, yes, one of the things that the government start is that we have to get out from our houses, always with all the things of by biosecurity, with our mask, to wash our hands and all the things. But we have to go out in a different day, by the number of our ID. If my number is 01 and then 123 and like that, you can go out on Monday, because Monday is 01, and you have to do all your stuff in a bank, to buy things, to buy food in a supermarket, or where you buy your things, and you have to go out by the date that you have to go out. And if you don't, a policeman came and said you are not legal today. And it's like our guarantees, they were not um, free for all, and we had to obey, because
Hmm.
some weeks in like almost in April or June, if I don't remember, yes, they take out that the people who doesn't have a mask, they were in the for example in the city, in the center of the city, they take to to the prison one day, and they sleep one day in there, because they were disobeying.
Hmm. And how so you were basically forced to be inside, and you could only leave one time every 2 weeks. How did that affect you, Hillary? How does that affect your emotional state of mind or your emotional mood?
For the people who like to work in outside, it's very difficult, because and also the people who the work that is in on touch with another person, is very difficult, because they are like acostumbrados,
They're used to, yeah.
how you used to be in that way, and touching with another person, and making for us the that we make some programs and some events with a lot of people, or we are like going to the institution of the government, and we have to talk with them, and with some programs and some activities we don't development them of, because it's difficult the situation, because they cancel all.
Yeah. So and maybe just to say that that whole state of lockdown really was for more than half a year. It's only recently that it's starting to open up a little bit. Now, Joanne, you have experienced many crises in Honduras, and I know you also brought some stories. But maybe can you help us understand, maybe also looking at it a little bit from the outside, how bad has this COVID-19 been to a country like Honduras? Go ahead.
Sure. Hi, everyone. I hope at some point everybody can put their cameras on, just so I can.
Yeah, let's do that. And by the way, we'll do that at the end. And also, yeah, Lisbeth recommended me, please send in questions as we go along. Then once we're at the last 15 minutes, we'll open up for everyone.
Perfect. Sounds good. Yeah, so yeah, I'm Joanne, and my husband Kurt and I have lived in Honduras for about 33 years now. It's crazy. And we were in Honduras at the start of the lockdown of the quarantine through the end of May, so about 2.5 months of it. And we had already decided we were going to do no traveling, and then my father died and my mom was alone. So we've been in the US living with my mom since the very end of May, and are planning on heading back to Honduras at the end of January. So maybe just to add a little bit to, I think Hilary explained really well what being in the quarantine was like. And for us experiencing it in both countries, Kurt and I were shocked that it was so different in the US. In Honduras, like Hilary said, you really couldn't go anywhere unless it was your day to be out. And in the States, in the US, everyone was complaining about how locked down they were, but all the stores were open, and you could go anywhere, anytime you wanted. Nobody said anything. So it felt very different here. Unfortunately, despite, I think, the Honduran government doing a really good job trying to get control of the situation right away from the beginning in March, and trying to do that well, COVID grew pretty fast and is still growing in Honduras. And I think that they have loosened restrictions not because the virus is under control, but because the economy is so incredibly impacted in a country which most of you know has very little safety net. We live in Nueva Suyapa. Our neighbors have not been able to work. My best friend and her husband sell shoes. Many of you probably have bought Suyapa sandals. They can't do anything. There's no market for their shoes. There's no ability for them to buy the materials to make them. It's been really rough, and that's the situation for the vast majority of people who are, working those kind of lowest rung jobs that are dependent on things being open. So for the rest of us, we just kind of go on with our virtual Zoom meetings, but that's not the case for a lot of Hondurans. So it's still growing. The impact on education and schooling, I wanted to talk a little bit about that. ASJ has been very concerned about that, especially because we work with so many families in communities, well, and because we try and strengthen government institutions. But we did some surveying of the impact on education, and it was really, really concerning. Before the pandemic, about a million Honduran children were not in school, out of a total of about 3 million who should have been in school. So almost a third of kids were either they had dropped out already, they weren't starting, for whatever reason, they were not in school. Since the pandemic, since March, that has grown to about 2 million children, which is terrible, right? And most of them, kids in private schools are doing okay. Most of the little private schools and the bigger ones have figured out how to do things virtually. The public schools in Honduras, and Hillary maybe will want to add something to this, her own experience or those of her friends, have not figured out how to teach the kids when they can't be in the classroom. So a lot of the private schools are doing things virtually, sending homework, and you have to send back the homework, or you have to make a little video for your teacher. The public school teachers are not. Most of the kids don't have data for their phones. They can't connect even through a cell phone. They might have a cell phone, but they don't have any money on the cell phone in order to connect. So that has been a huge problem. And you know, last year was pretty much a lost year in education for Hondurans. Yeah, maybe just put up the first slide of the little girl.
Lisbeth, can you help me with there's a picture, actually there are two pictures.
Okay.
I put them together.
Yeah,
Is that
great.
okay?
Sure,
Yeah.
That's fine. Yeah, I just grabbed some pictures. So the little girl, she's on the left on my screen, I wrote down her full name, Sharon Estefany Matute Canales, and she is from Flor del Campo. Some of you may know that community, and she's one of the kids who's in an impact program with ASJ. She lives with her grandparents. I don't want to share a lot of personal details, but neither of her parents are able to care for her right now. And she should be in the fourth, or should have been, the Honduran school year just finished up, but should have been in the fourth grade in her little school in her neighborhood. But, you know, basically she was not able to receive classes. Her grandmother normally works, but is not working right now. Her grandfather is a taxi driver. So during the quarantine, there was not a lot of need for taxi drivers. I'm sure things are better now as it's opened up, but it is a very, very rough time for the family. And I'll just say a little bit about what ASJ's kind of role is, what they've been trying to do. So we shut down, and we had to, because everything was shut down our brand new office building, which we were really excited to move into in January. And then almost immediately we moved in at the end of January, and we had to close down at the beginning of March. So we did not get to enjoy it for very long, but it'll come. But one of the things that our staff was really concerned about was how to continue working with the impact kids, because those programs, they're for at-risk kids in the Strong Families program. And, you know, they really rely on face-to-face. Every week we get together, we had, you know, you have a mentor. And so they were really concerned and very discouraged about what was going to happen. And it was pretty amazing how quickly staff figured things out. And one thing that we decided to do early on was to just invest budget in getting everybody money for their phones. So once a week, everybody gets data put on their phones, and that has allowed the program to continue. So they do everything virtually now. The photo on the right is just an example of a impact club. They celebrated Dia del Niño together. They got all the kids to perform on a Zoom call. And they've been able to interact with the kids. They do a lot of just kind of one-on-one calling, checking in with kids and their families. But, you know, despite that, I think that has been helpful. But overall, it's just been kind of a lost year for kids. And if you go to the next slide, yeah. So another thing that ASJ tried to do was at least get kids still their school supplies in the hopes that there will be school again. So this is a whole group of kids also in Florida del Campo who have gotten their school supplies. And just one more thing about kind of what's coming. There is no certainty at all how soon people will be able to be vaccinated in Honduras. So for sure, the beginning of the school year and maybe most of the school year next year, which will start in January, kids will still not be probably able to be in classrooms. So one thing that ASJ has been pushing the government really hard to do is to move learning to television, because although a lot of families own a cell phone, they very often, if they're poor, do not have money on it, as I already said. So the idea would be that the government could put together a uniform program for the whole country, and your grade would be at a certain time of day, and then you could go to your school, pick up handouts, do homework at home, drop those handouts back off at school, but receive instruction through TV. So we'll see what happens. It's obviously not ideal, but it's better than nothing. So maybe, yeah, Joanne, that's kind of where we are.
And Joanne, maybe you can say that in reality you have the initial problem that oftentimes kids are not in school. Like there are a lot of kids that are normally not in school. Then schools closes down, and then first of all, a lot of schools aren't equipped to do online teaching. And then on top of that, when the few schools that do online teaching, then the parents can't afford internet. They might only have one computer. So would it be fair to say that we're looking at the majority of kids in Honduras have lost this school year? Would you say so?
Yeah, well, that's where we get our number jumping from 1 million to 2 million being out of school, if you consider that they have had no contact with a teacher this year. And as I said, part of that last million are all the kids in private schools, which is, a considerable number. And then a few kids in public schools whose teachers have figured it out. But they have not gotten support from the Honduran government. So it's been very hit or miss. And we actually did a survey to kind of figure it out. And that's where we found out that private schools were doing substantially better, still not great, because a lot of them also are very poor kids whose parents are paying, $10, $20 a month to keep them in a non-public school. But yeah, for sure, it's a whole series of problems which will not be resolved next year either. But certainly it has been a rough year for any school-age kid who are in school or wanted to be in school this past year. Yep.
Thank you very much, Joanne. Now, maybe it would be a good time to compare a little bit to Nicaragua. Jaime, are you still with us? Do you have your camera? There you go. Yes. Jaime, now it's a little bit difficult not to talk about Honduras and Nicaragua without making a little bit of comparison. So I remember when we were talking, you would say that there hasn't been like an official quarantine, like people would have to be at home. But still, in the beginning of the COVID-19, a lot of parents were keeping their children at home for the risk of getting the virus. But can you tell a little bit, going on with the school perspective, how has the COVID-19 affected children in schools in Nicaragua over the last year?
Well, there was never a closing of the schools in Nicaragua. The government says we haven't officially closed the school system. So they were always open, and only those parents who freely wanted their children to go, they will go. The rest, they have classes virtually. I was seeing a report from CODENI, which is the organizations, the alliance of organizations that work for children. And they said 70%, nearly 70% of kids remained in the schools during the pandemic. Since, for example, in the first months, You didn't see many kids because you see the uniform, which is blue and white on the streets. But since September and on, now you see kids everywhere going to classes normally. So the system were never closed. And I talked to some of the kids who were, and they said just a few kids there to show up at school. So there was never a shutting of not only of school, but the whole Nicaraguan system were working smoothly. And the problem here, for example, was mainly with people who has to work or to live by themselves. You were here in my house, Arne, you would see people who fix toilets or people who repair a plumbery, and they shout announcing their services. So those kind of people were the one who will have suffered a lot if the system has shut down. This is something that just a few people could understand. During the whole pandemic, you had those one who had salaries and work at home, criticizing those who were on the streets, and they never understood that the only reason they were at home is because they have their food the 3 times a day, their meals. They never put on the shoes of those who needed to work outside.
And maybe for the people who are listening in, I can tell you that something just happened that is very common in Honduras. Hillary just wrote to me that electricity is out where she lives, and maybe for all of you that lives in Denmark, you know, you probably can remember the very few times there's been no electricity. Whereas here in Honduras, it's very common. Hillary lives in one of the areas where the hurricanes hit the hardest. So she just wrote to me that she's out of electricity, but she's trying to see if she can get back on the call. But that's just to tell that is really a normal frustration that the basic infrastructure that we would know in Denmark is usually working and help us get along. You know, those things are also very bad affected. But Jaime, I know that you have one thing that you have paid extra attention to is that maybe the school system has worked then a little bit better, but you have looked into a lot about the mental health of especially teenagers, where you said that you see a little bit of a tendency maybe to that there's a likelihood there will be increasing suicide rates or something like that, or teenagers feeling all pessimistic about the future because of the COVID-19. Can you tell a little bit about that, Jaime?
Well, it's a little bit curious because people post on social networks just positive messages. God is with us, don't be afraid, and on and on. But when you talk to them and they get to, they reach a moment, they get so frank about the situation, they confess they are desperate. And I could see this feeling wherever I went. I must confess that I never remain at home. I applied for a small phone, just $1,000 I received from an organization, and they put it in my personal account because they were looking for individuals who weren't to dare into the midst of the problems of the people. So with this money, I went to 4 different communities during the heights of the pandemic. And whenever I went, the main complaint of the population is we are desperate. We have no food, we cannot leave, children are boring at home. So the word was desperation. I had the opportunity to be in Cristo Rey, for example, a community that you know, where there is a dump there. And we had a workshop for people because they needed to be strengthened in their resilience. So our workshop were open air under the trees, everybody far away from others. And I remember a comic situation that happened to me there in Cristo Rey. I took a psychologist to the workshop, it was very difficult for me to find a psychologist who wanted to dare to show up there. All the psychologists told me, you must be crazy. I won't be leaving my house. So I finally got one who went with me to Cristo Rey. And while she was teaching in the workshop, I remember that she approached an old lady sat and the psychologist told her, how do you feel today? And I remember the old lady said, well, I had a fever. I have been with fever during 3 days and never go out. And when she said that, all the rest of the guys who were in the meeting, they start slowly moving their chair far away from her. So, and I mean, the population was desperate. And it was an opportunity to, I saw the need that people were saying, okay, we are Christians. What should we do? Is this what I have to be doing right now in a situation like this, to be locked in my house? So my message was, no, you can do something more than that. So I was publishing videos and pictures of the work we were doing. And of course, we had people who offended us in the social network, saying that we were not helping really, but we were causing more problems by delivering food and trying to join people together. But anyway, in every meeting, we were always trying to pay attention to health, that people do not infect each other. The food that we were delivering were properly cleaned and washed before it was delivered. But there was a message in the social network that nobody wanted to do anything for anyone. And that was something that I consider very dangerous. I opened a radio program, for example, in Baptist Radio. I have 4 broadcasts. And in those programs, we try to move the population to compassion, to think about those who didn't have food to share. And during all this time, I could see the changes in some people who at the beginning were offending roughly to those who dare to live at home because they needed to work. But when the months passed and they saw themselves that their economical income were decreasing, they also started to leave their house to open their stores and things like that. And they started to publish messages on social network more compassionate,
Yeah.
saying that now they understood that those people who cannot remain at home.
So you could say that like, and I know that, and maybe Joanne can tell a little bit about that afterwards. It's not like there has been food shortage, but since people are not making any money, they can't buy their food. You know, and then of course there was a lot of churches. You were involved, Jaime. I know ASJ was involved in making sure people had food to eat. But just going back to the question I asked initially, maybe do you think that we will see suicide rates or large youth depression coming from the COVID? I know in Denmark sometimes they talk about the COVID generation. Do you think so, or?
Yes, I am sure of that, because one of the things that I did was calling many teenagers by cell phone to ask how they were doing. And most of them told me, there is someone in this neighborhood who is thinking about killing himself. And by experience, I know that when someone says that, he's talking about himself or herself. But the person say it this way. I know someone who, so I found many of the teenagers I called saying me this. And the poll that we raised in Latin America with 900 teenagers, they were 900 polled teenagers, and 70 of them said the same. We know someone who wants to kill themselves. When I talk to teenagers, they told me that they feel that their life has been stopped, that they feel hopeless, that their future was over. You have to remember that we not only had this pandemic crisis, but also the 2018 political crisis. So they said this is the second year that we are losing our lives. And I try to encourage them, because when I was young, I was taken to the army, not by my will, but by force. And I lost at least 3 years during the war in Nicaragua. So when I entered the university, I was the older of all of them. The rest of them were very young people. So I tried to encourage them, talking to them about my personal experience. Okay, I didn't lose 2 years, but 3. And I managed to finish my career and to be a professional. So, but they really, I mean, the situation is that when you are Christian, you don't want anyone to see you down. So you pretend to be positive. You pretend everything is fine. I mean, you consider it a thing to tell the people what you are really feeling and how you are really living. So people lie in that situation. They pretend that everything is okay. But
Yeah.
talking to them in a very confident way, you really hear what is inside. And what is inside is people is hopeless. People is feeling that it doesn't make any sense what is going on. They have tried to understand from many angles, asking pastors and theologians what is going on, what is God amid all these things. And it seems that they have reached a point where they are not asking this anymore, because they feel that if they continue asking this question, they are going to hurt themselves. They are going to damage their spiritual life. So they are letting that question out. No more. They are asking, what is God here? Why this is happening? And He is not doing anything. So
And you can say, and you can maybe say, Jaime, that even though maybe, hopefully, there will come a vaccine and maybe we will return somehow to normal, but those psychological things underneath are really hidden problems we don't really know the consequences of yet.
yeah, and but it's going to be huge. We also have to add here that our pastors are not prepared. Religious people is not prepared to lead those teenagers who are frustrated. Because what the pastor do is to have a positive message again, which only makes teenagers think that they are the only one with this feeling and no one else. And also, many voices have been heard about God punishing, about I mean, if you trust God, nothing is going to happen. But the reality is teenagers are seeing that good people who have been serving at church, they are dying. For example, in my personal case, I know 10 different people who were friends of mine who have died of the pandemic. Most of them have people who have devoted their life to the church. They have worked a lot and they had a very ethic life. I mean, and those things scare people the most, because they say, if this one who has been so good, uh, he was infected and died, what is the meaning of all this? Does it
Yeah.
really mean that something worse is going to come and God is taking out the good people first? So
Yeah.
nobody is ready to answer these questions. And that is
No.
why our messages and preaching at churches, probably they are doing more harm than
Yeah.
helping people. And the tendency is to be quiet, not to let know anyone what is going on in your heart and in your mind.
Okay, and this maybe doing a little bit of comparison, because Joanne, this could almost sound like Honduras. Uh, Eventually Jaime touches on two aspects. One is that people can't work, so people need food, and that went on for 8 months. But then there's also the whole psychological part, like people lose faith in society or life really bringing them anything positive. Do you also think we're going to see an effect of that with especially with youth, that we're going to see that a year from now, those psychological effects?
Maybe two responses to that. One is that life has been hard for teenagers in Honduras for a long time. It's always so hard knowing like what my teenage years were like and how active I was able to be and how involved, and if I wanted a job I could find one, and comparing that to Honduran teens who would love to be working and can't find work and end up sitting at home on their phones because they can't find anything else to do. And I think for sure the pandemic has exacerbated that. It's made it worse. But it's been something that young people have had to deal with for a long time in Honduras. And because of that, I think there is a lot more resilience than I would imagine as teens, figure out ways to strengthen friendships or do what they can with their family. So I'm sure that there will be impact, but I also think that Hondurans, in my experience, tend to be much more hopeful than I think they would be. And I completely agree with Jaime that the church often is not helpful and just is, kind of brushes it off. But I also think that in general, I have seen Hondurans be much more resilient than I think my own culture would be in the face of so many problems. So, I'm concerned, but also hopeful that they will be able to move beyond this too. I mean, I think we just need to get past this pandemic and then see what kind of normal we can get back to, right?
Yeah. Maybe I should just say that also encouraged by someone who wrote to me, if everyone wants to put on their camera, because it's not like we're that many, so maybe you're already at home sitting and relaxing, but if you want to put on your camera so we can see you, you're very welcome. If you don't want, that's also okay. We are recording, so maybe you have to check your hair. There's Ricky. Hey, Ricky. And if you have any questions, just raise your hand in the chat, and then Lisbeth will open your mic, and then you can ask a question. So that's just an invitation to everyone to come in and participate if you want to. But Joanne, also a lot of times when we back in Denmark, we hear about Honduras, we hear about migration, and eventually before COVID hit, there was this whole talk about the caravans moving up to the border, the wall being built, and all of those things. So of course now borders are partly closed, to Guatemala, up to Mexico. But what do you think we will see eventually now with the hurricanes and the COVID? We will see a massive amount of caravans again in the new year?
Well, that's a very good question. And I think you should all first congratulate us on being wise enough to get rid of our horrible president. Yay. But the fact that Trump is leaving soon, thank goodness, I think will mean that the border to the US will be, this is a really complicated thing because President Trump's administration passed over 600 reforms to our immigration policy, which is already horrible, which will be very hard to just roll back when President Biden takes office. Some of them will be able to be rolled back and others won't. So for people like me who are really hopeful about immigration reform in the US, I'm not quite as hopeful anymore. But we definitely anticipate, especially, we haven't talked about the hurricanes at all, but the month of November brought 2 hurricanes, which devastated the whole northern part of Honduras. So people are very desperate. And when people are desperate, they do tend to try and get to the US. So there are definitely, most experts think there will be massive caravans coming from the Northern Triangle, El Salvador, Guatemala, and Honduras. And one of the things that in ASJ we're trying very hard to do, we have some friends in President Biden's inner circle, and we are strongly suggesting that they give lots and lots of aid right now after the hurricanes, and try to focus on building houses for people, because nobody really wants to leave their home country, but if they feel like there's absolutely no future for them, they will. And having a home is something really, really important for most vulnerable people in Honduras. So we're hoping that lots of aid comes in, that ASJ can do some monitoring of how that money is spent, and that money can be used for doing things that will be meaningful enough to people that they won't want to migrate. But regardless, people are going to try. It's been closed for so long that there's going to be a lot of pent-up demand once things open up after, you know, things are loosened after the pandemic. So
yeah, so yeah, I'm also fearing a little bit that we're going to see that, because eventually 8 months without any work, or 6 months in Honduras, absolutely. And we're gonna see that that push.
Well, now, and just to add one more thing, that the U.S. is desperately in need of workers. So, I mean, it's just sad that people end up having to go by caravan and use the asylum system rather than being able to go with a guest worker visa and work legally in the U.S., which is, you know, what would be good for both countries.
Yeah.
But it's become such a political issue that that's really hard to achieve. But that's what actually really needs to happen to solve this problem.
And another topic that that a lot of people has also talked about is whether or not the pandemic would increase the number of domestic violence and violence against children. And I've looked a little bit into it, and what I can see is that the general homicide rate, or the general amount of murders in Latin America, has gone down a little bit during 2020, because crime has gone down, because criminals has also partly stayed indoors. But it's been a little bit more difficult to find statistics or anything indicating whether or not we are seeing more violence against children, against women within the household. Jaime, maybe going back to you, because I know we talked yesterday, Jaime, and you said that maybe you were actually a little bit positive, that maybe it wasn't that bad in terms of violence in families. But could you elaborate a little bit on that?
Well, in a general way, every time that a disaster hit population,
could you give us the camera, Jaime?
Oh yeah, wait.
Thank you. There we go.
Okay, I was saying that in a general way, whenever a disaster hit a population, people tend to be a little bit more spiritual. And in some of the polls that I have done, for example, in Latin America, I have found an increase in spirituality. And by spirituality, I mean that people are praying more together. Families are reading more Bible. Families are having more religious services, whether be Catholic or Protestant. That's what this poll with 900 teenagers is telling me. And teenagers are saying also that they have experienced more love from their parents during the lockdown. And so it is not surprising that when I ask them if they are living a situation of violence, only 20% of them said yes. And I mean, I said only because the tendency is that 6 out of 10 families are having domestic violence. Also, because you know that when you are asking teenagers directly about their experience, they usually lie. So I asked them also if they knew someone else of their friends who were having domestic violence at home. And again, the percentage didn't pass the 20%. So I have heard a lot, for example, from the UNESCO, UNICEF, the United Nations agencies. They all are presuming that this lockdown has necessarily come with an increase in domestic violence, but in the case in Latin America. Also, in the particular case of Nicaragua, the only organization who did a poll was CODENI, and it was a surprise to me that they didn't ask this question. They asked about everything, but they didn't ask about violence. My perception is that they did so, but because the percentage was very small, probably it was taken out from the poll. Because that's the problem here is that if you publish a poll saying that domestic violence is getting low, is getting down, you get into trouble. Everybody attack you. Everybody's saying that it's a lie, that I mean, people feel really offended. An organization, civil society organization, they take it personally. So it's very difficult to publish a positive results in the level of domestic violence. But as I told you, I haven't found any evidence that tell me that it's getting high.
But Jaime, could you say that still there is some uncertainty because also maybe during COVID, we don't maybe not everyone is reporting, or the data coming out from your government or from government institution might not be completely reliable. But then on the other side, it could also be that families has been more together. So in some families, it might even have been a good thing. Is that your conclusion?
Yes. In a previous poll that I did in 2016, I could see that most of the domestic families, domestic violence, come from families who are living by just one parent. That was a tendency. You had families with two parents, domestic violence were low. What is the interpretation of this? Probably that having two adults in a family makes that they level each other. For example, if father see the mother is committing violence, he stop her, or vice versa. So that's my explanation, because I don't see another reason why when the children are living with only one of the parents, domestic violence goes high, according to this poll that we did. So going back to these 900 teenagers who were surveyed in Latin America, I found that more than 60% of their family are headed by both parents. And probably that's the reason of these results. Another explanation of this could see that when you are amid a disaster, there are things that you don't pay attention to. Okay, if the river is overflowed and your house is floating, you are not paying attention if you have light or not, or if you have a latrine or not. I mean, because you have a huge, a bigger disaster to face. So that could be another explanation, that teenagers seeing themselves amid the disaster, because you have to understand that even though maybe in this community where they are living, they are not seeing too much death, but they are seeing a lot of news, bad news, and parents tend to multiply this bad news to teenagers. So they feel that what is going on outside is a complete disaster. So probably this could make that those, what we consider domestic violence, could be seen as a minor problem by them. But I am supposing. You ask me about hard data says that there hasn't been an increase in domestic violence.
Yeah, okay. Thank you, Jaime. We got a question in where it says, is it your feeling that there has been an increased social control in the families, Joanne? Or maybe you could tell a little bit about the family dynamics. Do you feel, is it your impression that families have grown together, has come together? Or is it your impression that we might have seen more control or more violence within the families? Do you have anything indicating one or the other?
Well, if we believe the teenagers are saying that they see more unity in their they are seeing more unity in their families. They are seeing more love from their parents to them. That's something that is directly expressed by teenagers. So we believe them. Families have come together more now during the pandemic.
So that's a positive thing. I want to go to Honduras maybe to see if that's the same. Joanne, is that also your impression that in the midst of this crisis, maybe it has done something good to families?
I think you see both things, and I think we won't know until it's over and we can actually get around and talk to people more and do some surveying. But just incidentally, what I know is that people are enjoying being together, but they're also so sick of each other, just like all of us, right? Like, you know, some of my best friends talk about their kids like really just not even wanting to come out of their bedrooms anymore, because they're just, you know, the more introverted ones are just sick of everybody being on top of each other in small houses. But at the same time, I think there are families who are enjoying, you know, being together and figuring out ways to do life together without all the, you know, distractions. And I think it depends on economic class as well. As Jaime said, you know, poor people are desperate, middle-class people are maybe trying to work from home, and it's really hard to, you know, do school with your kids or even take care of them when you're also trying to work. So I think yeah, there's going to be a number of responses to that. But I agree with Jaime that I haven't seen a lot of indication that there has been a big increase in domestic violence. And I don't know, also, I'm curious about alcohol consumption, because those things are tied together so much everywhere, but in Honduras for sure. And I don't know, you know, if there's no money, it's also really hard to drink heavily. And that may be a reason that domestic violence is going down rather than up, if that is the case, which I'm not sure either. And there's also, just to point out, there is another question about
yeah, go ahead.
Schools in Honduras. I do not know when schools will be opening in Honduras. They've just gone on break and they come back in January. I'm quite sure they will still be virtual then. I don't know. I think it'll be tied to vaccinations, and you know, from what I'm reading, 4 countries are going to lose out in the vaccination race. So I don't know what to expect. And as far as numbers of COVID-19 in Honduras, the graph goes like this. So even though, as I mentioned, things are opening back up, that's not because COVID-19 cases are dropping. They are not. And I know lots and lots of people who have had COVID, who have died of COVID, who have not been able to get into the hospital because of COVID. And now we just have the hurricanes where about a little under 300,000 people are jammed into shelters. So that's not going to be good either as far as keeping yourself safe. So.
And you can maybe also say, Joanne, and that is something we might forget when we're sitting in Europe or the US, that these countries don't have the same amount of testing. So eventually, if you see some numbers, you have to multiply them with, I don't know, 10, 20, 50 to get the real numbers, right?
Yeah, well, it is interesting because testing is very widely available, but I don't know how many people are getting tested. I know the ASJ staff gets tested all the time, and we have had a very high positivity rate, but we also have a very high testing rate, and I'm not sure in the country as a whole what the testing rate is.
Yeah.
So yeah.
Okay, we're getting close to finishing up, but any last questions, send them in. Maybe you could just say, Jaime, how is it your impression that the COVID-19 numbers, is that growing, or is it really the same as ever in Nicaragua? The microphone.
As we cannot trust the data from the government, which says that only 230 deaths has been caused by COVID. And then you have the independent doctor who are saying that more than 2,400 people have died. I've been calling some doctors who are working at the hospital, who are a friend of mine. And what they tell me is that during the months of May, June, and July, for example, all the hospitals were out of their capacity. They were full of infected people in such a way that if new cases arrived, they were sent home. But today they tell me that the hospital are not in the situation anymore. But a phenomenon that is happening is, for example, you have a hospital where there is no case at all of COVID, but suddenly 30 people arrive together at the same time, all of them infected. So what they are saying that we are in danger, that if people try to get down their guards in this time, we could probably get an increase in cases again. So so it's evident by this testimony of the doctors that numbers are slowing down. But if people just happen to go out and doesn't have precautions with mask and healthy roles, probably we could see a phenomenon like this, that some percentages of cases going up in special circumstances.
Yeah, and I think I could say that it's probably very likely that we're going to see things in Central America that are similar to what we've seen in Europe and in the US, that eventually at some time the curve is going down then people are going out, and then it's going to go up again. And the only difference probably here in Central America, in Honduras and Nicaragua, is that people are much more forced to be out simply because you know, you have to make money, you have to put food on the table. Anyways, we come close to finishing up, and I just wanted to say that in case you want to learn a little bit more about this, then Jaime is going to make a presentation about his study. We're going to put in a link somewhere because only I have it at the moment. But I make sure if some of you want to know about his survey for Latin America and how teenagers have perceived the crisis, maybe if you have the link, you can just put it in the chat, Jaime. That would probably be the easiest thing if you have the Zoom chat. And then if you want to follow ASJ's work, I would really recommend Joanne put the link to the webpage, but also follow them on Facebook and on Twitter if you want updates on that. And then Viva Denmark, who's hosting this seminar, we did a couple of videos that you can look at on Viva Denmark on Facebook. There's a couple of videos about how does it affect schools and children being out of school. How do you still stay in school if you're only, you know, accessing school through a cell phone? And there's a mobile pay number if someone wants to send in a donation. Right now, Viva is collecting money. There's still a lot of families that are out of work. So there's some help packages of food and basic necessities that are going into helping in Honduras and in Central America. And yeah, Joanne put in the webpage there for ASJ. And of course, we also like to ask your prayers for Central America. It is really a difficult time. So I know that just back home in Denmark, our Prime Minister just announced that everyone has to not sing around the Christmas tree and have to stay at home. But I can assure you that the problems here in this region are a little bit tougher. So we definitely appreciate everyone who will keep following the situation and you know, keep attention to on Central America what we're posting online. So I think I'll just say thank you for everyone participating. Thank you, Joanne, for being with us. Thank you, Jaime. And Hillary, she writes me that now it's raining and they have no electricity, so she couldn't be on again. So yeah, that's just how it is often. But thank you so much. Maybe a final word, Joanne and Jaime. Joanne first.
No, thanks so much for the invitation. It was really, yeah, just good to talk about these things. And also, as far as electricity getting cut off, ASJ is doing a really in-depth investigation into corruption into the Honduran electric company, which hopefully will lead to better electricity for less money and more money for other things. So
yeah, that is a typical problem. Some final words for you, Jaime.
Well, I want to say that the present situation is very chaotic, and if we really want to learn something from what is going on, we have to learn to listen and to see. If we try to understand what's going on from presumptions, from thesis from the beginning, it's going to be very difficult that we really get to the point. So we really need to listen to teenagers. Something that I am remembering right now from the poll is many teenagers said that they are happy in their homes. And when I asked why, many of them told me because we are not going to school. So, I mean, nobody likes to listen this kind of answer, but it is the kind of answer a teenager is given. So it's very difficult to understand many things that are happening. So we need to pay attention closely to children and teenagers if we really want to understand something.
Yeah, and you can say this 2020 is really a gift for anyone who likes to go into the data, because we're getting, you know, there's so much disruption that we're learning different things about how people are behaving. But I would say, ending on a positive note, it is good to hear from your study, Jaime, that some teenagers actually say that they feel it's done something good for their family. That is, in the midst of all the bad news we're hearing all the days, that is at least very positive. So I think on that note, we'll say thank you to everyone. Thank you for tuning in, and have a good evening back home in Denmark. Bye-bye.
Merry Christmas.
Merry Christmas.